You're watching TV9 News and I'm Prajwal D'Souza. The second wave of COVID-19 in India has seen several post-recovery conditions in COVID-19 recovered patients. One such infection which has worried the health authorities across the country is black fungus infection or mucormycosis. Now, according to the US Centers for Disease Control and Prevention, the US CDC, black fungus is a serious but a rare fungal infection caused by mucormycetes, a group of molds that live in our surroundings. The cases of black fungus were reported in some parts of the country. Some severe cases have led to major surgeries and a loss of vision. Some of the common symptoms of black fungus include discoloration of the oral tissues, tongue, gums, a stuffy nose, swelling of face, heaviness below the eyes, discomfort, fever, and a headache. The central government had released guidelines outlining the do's and don'ts of black fungus infection. The fungal infection has underscored the importance of maintaining good oral hygiene. We spoke to Dr. Karan Ganapathy, a Bengaluru-based orthodontist, to understand the importance of maintaining good oral hygiene to keep mucormycosis at bay. Doctor, how important is early detection in treating mucormycosis?
In certain conditions, maybe diabetes or leukemia, or if you're on certain medications, that is corticosteroids or chemotherapeutic drugs, the immune system gets suppressed, and because of this the fungus starts to grow. Now, symptoms of these aren't detected too early. They also mimic the flu quite closely, so people aren't looking for it. So vigilance is a must. They can be quite fatal if left for too long. So things like heaviness of the face, fever, headache, discoloration of the oral tissue, maybe your gums, your tongue. All these are symptoms that you need to take a look at, especially in this present situation with COVID. Patients are being treated with corticosteroids, which does suppress the immune system. So anyone post-COVID treatment who are developing any of these symptoms should be a little vigilant and should probably visit their doctor and get treated.
How important is oral hygiene to keep away from mucormycosis?
Certain conditions for them to thrive. Poor oral hygiene can be one of those conditions. Now, a good oral hygiene can reduce the microbial load and hence reduce the spread and growth of mucormycosis. Now, regular visits to your dentist is also recommended, as poor gum health, gum infection, any other infected teeth that can cause increased inflammation or severe inflammation can lower the immune system and therefore lower the response to fight off these infections. If left untreated, then they can affect manageable conditions like diabetes, heart disease, hypertension, and make them even more serious.
Doctor, what are some of the tips to maintain good oral hygiene?
When it comes to oral hygiene, it's nothing that we haven't been taught all our lives. Brushing twice a day for at least 2 minutes. Interdentally, that is between your teeth, you either floss or use a interdental brush. Never try to use a toothpick. Use a tongue cleaner to clean your tongue. But I think the most important, especially for black fungus, would be vigilance. Make sure you check your gums if they're bleeding, if there's a bad smell from your mouth, if your teeth feel loose, if there's a discoloration in your gums. That would be indicators that you need to come in, you need to show it to your professional, and if detected, the only treatment would be quite aggressive medical or surgical intervention. So your doctor will have to be informed, and you'll have to get treatment from a physician.
Doctor, how important is oral rinsing?
Oral rinsing can be quite important. It reduces the microbial load within the saliva, be it the COVID virus or mucormycosis or whatever. You tend to reduce the load of the microbes, so therefore reduce the spread through the saliva. Now, this can be done by a betadine gargle or with chlorhexidine mouthwash, which are readily available over the counter at any pharmacy.
Doctor, how and why should oral hygiene equipment be disinfected?
In our present scenario, it is definitely beneficial to separate every family member's oral hygiene kit be it the toothbrush, toothpaste, tongue cleaner. Disinfection of this equipment can be effectively done by soaking them in antimicrobial mouthwashes. And if you are diagnosed with the condition and once you're freed of it, disposal and replacement of your entire oral hygiene kit is a must.
The doctor has stressed the importance of maintaining good oral hygiene. While mucormycetes is a rare fungal infection, it is important to maintain a good oral hygiene and follow these tips mentioned by the doctor. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.